Welcome back. We are looking at lots of topics today, and right now we're going to talk a little bit about the most current issues in clinical centers. We have with us Nuzhat Chalisa from Moore's Hospital in Chicago and Edward Chao from University of California in San Diego. Thank you all for joining us.
Thank you for having us.
Thank you for having us.
And we had a little bit of conversation beforehand. One of the really interesting treatments that's coming around right now is instead of just working with insulin, we're also adding in the GLP-1 RA. So tell us a little bit about what that means for treatment.
So GLP-1 is another class of medications, which it's like another hormone, like insulin that comes naturally in your body, but it has additional benefits other than lowering glucose. Like it helps with lowering your cardiovascular risk. It also helps with weight loss. So addition of that agent to insulin is really helpful.
And tell us, who benefits the most from these types of treatments?
Patients who are not at goal, A1C, despite their best efforts at adhering to medications that they're on, like oral medications, exercise, diet. Diabetes is a progressive disease, and certainly, despite best efforts, people can still be above goal.
And so these will really help kind of fine tune and get them into that.
Right. If someone is already on insulin and needs additional medication, and if the A1C is not controlled, adding a GLP would be helpful. But now, if you have that in a combination, then instead of taking 2 injections, they can take 1 injection.
And that leads right into the next question. Would that be kind of one of the things that's really most exciting about these new treatments?
Definitely. I think a lot of times we have to be mindful of therapeutic inertia, where patients and healthcare professionals may be hesitant to add medications and intensify treatment for various reasons. Denial, lack of knowledge, just not wanting to be on multiple medications. A lot of patients will say that. And I think this is a promising combination to address both these things, the therapeutic inertia, but also the progression of disease.
And, what are some more novel ways that in the clinics we're seeing some treatments maybe a little bit different, a little bit newer?
Yeah, so I think adding GLP-1 can be added used as a second agent to metformin. So if someone is on oral medications and 1 or 2 oral medications, and now we want to add a third one or a second one, GLP-1 can be added. But after that, if they require more medication, and we talk about insulin, sometimes patients are reluctant to do that. So if we can say, okay, we're going to add insulin, but you're not taking any additional injections, you're already on GLP-1 injection, we're just switching it to a different one that is combination, then they usually are more acceptable of it. So this has really helped, avoid polypharmacy, because instead of doing too many medications, you can sort of concise that. It also helps them with co-payments a little bit.
So do you think, is there a large population that's going to benefit from this?
Yeah, I think it's being currently the use of GLP-1 is really increasing, and I think it has its benefits beyond just lowering glucose is what's helping a lot. Cardiovascular patients with diabetes are at high risk for cardiovascular disease, so this reduces your risk of cardiovascular disease. And then obesity has been a big problem. So I think the weight reduction benefit is what attracts people most.
We have to keep our minds open to new approaches, right? New combinations, and also remember the patient's perspective in all of this, because patients will sometimes be hesitant to intensify treatment regimens for the reasons I was mentioned before, but also I think it's just that therapeutic relationship between physician and patient is very key.
Okay, well, thank you guys so much for joining us today. We're going to have more as we head into the close. We're getting pretty close to the end here of ADA TV.